Hello, everyone. It's so nice to see everyone here. I can't tell you how honored I am to be a part of this amazing panel, how excited I am to just educate myself on brain health, on our hormones, on why dementia, why Alzheimer seems to affect women more. My mother was diagnosed with early onset at the age of 64, and it was a heartbreaking journey. And I made the decision once I went through this that I was going to be an advocate for dementia. And so I always said to myself, if I could just prevent anyone else from experiencing this, from the heartbreak of just knowing the warning signs so that you could make earlier decisions, I would definitely do that. So it is just a pleasure to be sitting here with Dr. Brinton, Dr. Caldwell, and I don't want to mess up any names, Dr. Mosconi. Thank you guys so much. We were actually chatting. I want to like call you all by your first names because we've already been in here.
Of course.
We've been having lots of conversation. I think I'm going to even sign up to do some pre-measurements about, checking my brain health. And I'm just so excited. I just want to hurry up and get this conversation going because we only have a limited amount of time and I want people to get as much information as they can. So I'm going to start with you, Dr. Brinton. Go ahead and introduce yourself and what your specialty is.
Yeah, so I lead the Center for Innovation in Brain Science here at the University of Arizona. So hello to the Kelly Rose in Tucson. My interest has really been, why are women at greater risk for developing Alzheimer's disease? And have been researching that question now for many years and looking forward to sharing some of that information with you and some of our strategies to mitigate and reduce that risk. And collaborated with Lisa Mosconi now for many years. I'm looking forward to collaborating with Dr. Caldwell.
Dr. Caldwell, I'll have you go next.
I'm Jessica Caldwell. I'm the director of our brand new one-year-old Women's Alzheimer's Movement Prevention Center at Cleveland Clinic in Nevada. I am from Michigan. I see we've got some Michigan people in the group, so yay. My research has always focused over the past 6 years on sex differences in Alzheimer's and specifically how men and women's brains look different when we're at risk and then when we get the disease. And now I'm focused on prevention, what works for women in terms of changing your lifestyle and what women like and will continue to do in terms of lifestyle change that we can sustain.
And Dr. Mosconi?
Hi, I'm Lisa Mosconi. I'm the director of the Women's Brain Initiative at Weill Cornell Medicine in New York City. I'm also associate director of the Alzheimer's Prevention Clinic, also at Weill Cornell. I'm an associate professor of neurology, neuroscience, and radiology, which is interesting to me because my background is really nuclear medicine, so brain scans. We do a lot of brain scans for preventative purposes, and I have been beyond blessed to be working with Dr. Brinton for quite a few years now. I started out when I was still at NYU, and we continued our collaboration as I moved through Cornell, and that's been absolutely wonderful. We're looking to work with as many women as possible. We always encourage participation in research. We've been trying to get Liz to sign up for our studies. I am super excited about it. And your sister, if she wants to join us, that would be wonderful. We do hundreds and hundreds of brain scans, and we just published a new study that Maria's team suggested we talk about with Dr. Brinton. That's really all about menopause and how menopause changes women's brains. And it's not all bad news, which we thought would be nice to share today. And my research is really all about understanding how brain health plays out differently in women and in men. We also really care about the men in our studies, but our focus is really unapologetically on women's brains.
Amazing. I want to get right into it. Let's talk about brain health, hormones, and I want to talk about early menopause because already, if you can just explain what's happening to the brain just in the shift when you're not having to worry about dementia and Alzheimer's yet, just that simple shift of hormones and estrogen.
So that's where we really started our research, was trying to understand what happens to the brain during this transition. And essentially, menopause is like puberty. It's, I know you go in and it takes a while for this transition to happen. And then when you come out of that transition, you're different. And we typically think about menopause as around reproduction, but menopause, perimenopause, that period of time before, and menopause is really all driven by the brain. Your brain controls this entire reproductive system. And so it's a remodeling project. It's a remodeling project on the brain. And like any remodel, lots of it is just fine. And then there's always that 10%, maybe 15% that's just not fine. And what we have found is that the brain can undergo what we call an energy crisis. And how we respond to that energy crisis is critical. And why that's so important is the brain is an energy hog. It's like from here down, we're a Prius, from here up, we're a Hummer. And so when there is a decline in the brain's ability to generate sufficient energy, the brain will immediately suffer. And that first signs of that that problem with energy is in cognition. The kind of behavior, the cognitive function that you're doing right now. You're listening to me, you're whirling around in your brain, trying to find, hey, that sounds familiar. And now you're generating a new connection. That's very energy demanding. Yeah. So that's kind of where we've been. And now we're developing strategies to promote health and sustain health in the brains of women.
So in looking at that, what are some of the actions we can take as the brain is beginning to change? I mean, what are things that we really have to look out for? I know for women, like obviously our estrogen levels are starting to go down, or the brain's trying to, talk to the ovaries like, hey, where's the estrogen at? And then the brain gets mad because it's not getting the normal hits. So what do we as women have to do to make sure that, are we eating foods that are high in estrogen? Are we needing to drink more water? I mean, I'm just shooting in the dark here. Exercise. What can we help how can we help ourselves as we go through a second puberty, so to speak, but now it's menopause.
It's like puberty in reverse almost, right?
Yeah.
So I'm just going to quickly make mention that work that we have done and others have done has shown that women who have elected to receive hormone therapy have a reduced risk of developing Alzheimer's disease. Right? Not all women want to do that. And part of what women's concerns are is essentially, well, it might be great for my brain, but I have this concern around breast cancer. So one of the things that we did is we listened to women, right? And we're now developing a safe and effective alternative to estrogen therapy that works like a great estrogen in the brain, but not in the breast. So promoting brain health and protecting breast health. So we're hoping to have that development come publicly available in the near future. But I also think that in addition to this, I know both Dr. Caldwell and Mosconi have really defined a lot of what we can do to sustain brain health over this transition.
I'll interject here just super quickly. If the clinical trial that Robbie just mentioned starts as soon as we hope, we will love participants for the clinical trial. So this estrogen formulation that is very protective of your brain and your breast and your ovaries at the same time, hopefully will be a clinical trial really soon. We're going to enroll patients as soon as we're able. And we would love for anyone who's interested to discuss participation, right? Because there's no research without participants. And I think we would all agree that if you're not part of research, you're not informing research either. And a lot of people don't realize how powerful it is to be part of these preventive efforts. There's not just Alzheimer's prevention in a clinic, there's also participation in clinical trials that is very, very valuable. And I think it's quite unique. So that's one thing that anyone can do. Look it up, find out what kind of research programs are available to you, perhaps in your area. Find out if you're able to travel, come to us in New York so that Dr. Brinton can give you her latest magical estrogen formulation. I personally, if I had the hot flashes, I would get it immediately. I'd be the first brain in the scanner, which is our scanner. So yeah.
So I really want to make a quick point here. There's a concern that was raised by Patricia around estrogen is bad for your brain. And so there's been a lot of different types of outcomes. What I will tell you is that women who receive estrogen therapy at the time of their symptoms, not 5, not 10, not 15 years later, right? Which is where those effects of estrogen have the kind of negative effects. And actually they're not that, it's not so negative. It's that, you know, just like with puberty, you're different. So once you've transitioned out of menopause, right, your brain is different. And part of that difference is you don't have an estrogen response system any longer, right? So giving estrogen to the brain 10 years, 15 years after menopause, when most women are no longer have symptoms, is not beneficial. I totally agree. It is not beneficial. It's beneficial when you have symptoms of estrogen deprivation, which is, you know, something that Liz was referring to. And Lisa, when you have hot flashes, when you have mood disturbances, when you are clearly going through this transition state.
When you can't sleep.
And sleep, right? Not 15 years after. It's not going to work then. It's
So let me ask a question. Is there a specific website people can go to if they want to participate in a study?
Ours. Were you pointing at me, Robbie?
Yeah,
I know your point.
General. If Dr. Mosconi, if you can just type it into the chat so people can see where that website is. And in the meantime, Dr. Caldwell, I want to ask you about stress, because we have a lot of stress in our lives all the time, year round, and that does affect our nervous system, which then affects the brain. And you and I were talking a little bit, ago about the importance of exercise and meditation. How can we help our brain health by incorporating these things into our lives? And I think diet too, our gut is, I always say, the other brain of what helps maintain up here. So how do all of these play a part in regulating hormones and brain health?
Absolutely. This is a great question. So as someone who works with patients on changing their behavior so that they can reduce risks for Alzheimer's disease, I think a lot of different types of changes are important, but exercise is one of those ones that I consider a first-line multitasker. Exercise, if you can get that 150 minutes a week, if you are young, if you can get that high-intensity interval training, what you're doing is potentially directly impacting the memory systems in your brain, the neurochemicals that will support your memory over time. But you're also doing more than that, because exercise positively impacts other things that are risk factors for Alzheimer's. So it can be an important tool to have if you have medical risks like diabetes and hypertension. It can decrease depression symptoms, and of course, it can decrease stress. And stress is one of those things that's not on our list of direct modifiable risks for Alzheimer's, but we know if it's chronic, it's not good for the brain, and it's specifically not good for the hippocampus, that region that's important for new memory formation. And another thing about stress is I think of it like a roadblock. So if you have chronic stress in your life and you're at midlife, and sometimes you can't change it, you might have kids, you might be taking care of parents, you might be working 60 or 70 hours a week. You can't remove it. But if you don't address it, then it's going to be very difficult to really live a healthy prevention lifestyle if that means a lot of change for you. Stress can be a really big hurdle at the front of that. And it's important to really take steps doing things like exercise, or meditation is another one that we recommend all of the time, because it really is something that, can be helpful in the moment if you're stressed. And if you do meditation regularly, and I'm talking about even 5 minutes a day, you can give your brain a little bit of practice letting go of things that are going to support your chronic stress response, like those thoughts about what's going to happen tomorrow, what did I just do at that last meeting? Did I do it right? And if you can separate from those things better, you can help yourself respond better neurochemically to the stresses that maybe we can't take away.
Yes. What kind of meditation do you do?
Mindfulness. So I'm a big proponent of mindfulness meditation. I'm very biased. It was a big topic of research in my grad school lab. So I know that it changes your brain. And I know that if you practice it over time, it can really give not only stress response benefits, but kind of perspective shifts in terms of, for example, compassion. And one of the things I think women could really use at midlife is self-compassion, because like we've been talking about puberty and menopause, I think from a psychological perspective, are times when the world isn't always very nice to us about what that means for our worth. And so having another way to kind of reframe what your worth is at that time, I think can be another totally different kind of benefit.
I completely agree. I also practice mindfulness meditation. Like, how do you like Jack Kornfield?
That isn't the one that I've familiar with. Yeah.
Well, see, now you have two options, Liz. You were asking, right? You were like practical tips. So 2 different forms of mindfulness or insight meditations. 2 scientists practice that. Dr. Brinton, do you practice meditation?
Actually, I wouldn't call it meditation, but what I do practice is connecting with spirit, connecting with being present of, I can't be grateful enough throughout the day and seeing the silver lining. So it's not kind of that mindfulness, but I do my kind of spiritual gratitude like I do my interval training. It's like, oh.
I think it's so important that we are mindful. I mean, this is what my company Wordful is all about, because it started basically, my mother started to lose her speech, and she was only left really with 2 phrases, and it was, I love you and thank you. And it showed me, 1, the power of our words, but 2, the power of our self-talk. And Dr. Mosconi, what you mentioned, and even Dr. Caldwell, is that self-compassion, that self-love, that self-talk, because that does affect our brain, whether we realize it or not. If we are hard on ourselves, if we're always critical of ourselves, if we're not paying attention to that inner voice, it really does direct our lives and how we care for ourselves. I do want to talk a little bit about, and selfishly, I'm going to ask this, for someone like myself, and I'm sure there's other people in the audience who maybe have experienced this, when you've had a parent who's had Alzheimer's, is there other precautions or other things that we need to be mindful of, that we need to be paying attention to? Obviously signing up for research is really great, but in my everyday life, what do I or other people that it's a possibility that it's hereditary, or it's a possibility that it's not? I think even with my mother, she was the perfect storm. She had high blood pressure, she had thyroid, she had a hearing issue, and it's so wild because just recently during the pandemic, I experienced sudden hearing loss in my left ear, and I panicked and I thought, oh my God, I'm going down the same path. And I just, we have to talk ourselves off the ledge a lot of times. We forget a birthday and we think, oh my God, it's happening. And I think that can be really, again, the stress levels that we put on ourselves. So
I want to jump in here to address that question, Liz, and then hand it over to both Lisa and Jessica. So we did a study in really trying to address the question, can we identify women at risk for Alzheimer's disease when they are still healthy? And what we discovered is that women who maintained metabolic health, nobody had type 2 diabetes, nobody had cardiovascular disease. So we looked at a group of 500 women, all who were healthy, all within this 50 to 65 age range. And what we found is that there was a group of women who were metabolically well controlled, and they had the highest cognition. There are women who were at risk for hypertension, cardiovascular issues. They had a decline, but not statistically significant. When we looked at women who were at the edge of being, having metabolic syndrome or type 2 diabetes. They were still in the normal range, but they were on the wrong end of normal. They had significant decline in their cognitive function. Now, when we looked at who was actually driving that statistically significant decline in cognition, it was women who had the ApoE4 Alzheimer's genetic risk factor. But that genetic risk factor was distributed evenly across these, all these groups, these three groups. So what it told us is that having the ApoE4 gene, it's a risk factor, but you had to have the risk factor plus, worrisome metabolic function, that you were on the edge. And now all of a sudden what that means is that you can come back from the edge. So you can come back from the edge, you can mitigate that risk. And I'm going to turn it over to, two folks who devote a lot of time and energy to mitigating the risk.
I want to jump in really quick. Is that the theory that we can turn our gene on and off depending on our lifestyle and good health, eating habits and exercise?
So no, you're not turning it on and off. It's on all the time. The difference is that you can essentially reduce the impact of that genetic risk. There are lots and lots of people who have the ApoE4 gene, right? And they don't develop Alzheimer's. Why? Right?
But I think Liz is talking about epigenetics.
Yes.
So, about epigenetics.
So the ApoE4, you can't turn it on and off, you just have it. But I think what you were saying is that lifestyle is a very powerful epigenetic switch.
Yes.
It can really activate genes that are protective against brain aging, Alzheimer's disease, and diabetes, and cardiovascular disease, or turn those off and activate genes that put you at risk. And to Robbie's point, and I'm sure Jess would probably mention that too, it's really important to address any medical conditions that can potentially have a negative impact on brain health and also exacerbate whatever Alzheimer's disease predisposition. And the key ones are cardiovascular disease, diabetes, obesity, and I would say metabolic dysregulation, like metabolic syndrome, which is what Robbie was talking about. That's a really important thing. And the way you mitigate these risks, not necessarily pharmaceutical, but it could be, but there's also a very strong lifestyle component, right? Jess, you mentioned exercise. Meditation, I don't know if it helps in this case, but diet, I'm a big proponent of eating healthy for your brain. And I think the bottom line is that trying to eat more plants and less animal foods, perhaps fish, right? I mean, we like fish. Fish is good for your brain. But plants contain antioxidants, they have fiber, they have phytoestrogens, which you mentioned before, Liz. It's something that can have a regulatory effect on your hormones as well. These are very important things. And then stress reduction, Jess mentioned that. I think exercise also helps reduce stress at the same time. Sleep is something Robbie really did not want to talk about, but we're going to mention it. Jess, more. We have more. No smoking. I'm sorry.
Oh, I was going to say the effects of smoking, how Dr. Brinton was saying it affects women more than men.
That's right. But smoke also, did you mention it live, Robbie, or was it before? It was before. The smoke is so specifically bad news for women's brains, right? It
impacts women much more than men, right?
Yeah, and also, I mean, smoking is an ovarian toxin, is the number one risk factors for early menopause. So that really should not be a thing anymore, right, Jess?
Yeah, and I totally agree with the things that you're saying, and I wanted to just go back to this idea of how worried should I be and am I at risk? And just for those folks out there who haven't heard some of the numbers around this, that having just a single person in your family with Alzheimer's, it increases your risk about 20 to 25% above someone with no Alzheimer's in the family. It's a very similar number if you know you have one of those risk genes compared to someone who doesn't have the risk genes. 20 to 25% is not 85 to 95. It's not 100%. This is not, having that family history is no guarantee, even if the person who has it is exactly like you. One of the things I commonly hear is, but I am my mom. You know, we have the same face. We have the same thinking style and personality. We have the same nose. None of that is genetically linked to your Alzheimer's risk. So just to have a little bit more hope and just know that actually having a good outlook is associated with better cognitive aging. And if I can encourage you and kind of encourage that better outlook with reframing how you think about having a risk that runs in your family, that can be something that you can do right now as well.
Yeah, I think that's, again, going back to that self-talk, is we can almost make ourselves sick. You know, we put on that chronic stress of, I already know what my future holds, and therefore I'm almost talking myself into it. You know, it's you've got to see yourself as a unique individual, and how can I care for myself? How can I take preventative actions? I would love to know, just from all of you, just more preventative actions that we can take, or things that we need to avoid. I know, you know, all of us think that we're doing ourselves a favor by having a glass of wine at the end of the night to unwind. You know, you hear so many, red wine is good for the brain. Is it really good for the brain? I need to know.
Maybe that's not the first one.
It's good for mood.
Yeah.
So there's been some questions that have come up in the chat, which I think are very important. And so there are modifiable risk factors. We've talked about that: sleep, and, you know, our diet and exercise, our mindfulness, our reduction in stress. If there's a family history of Alzheimer's disease, I would recommend that people consider having genetic tests for risk factor genes. Again, these are risk factors, as Jessica was saying, these are risk factors, these are modifiable. But if you don't know you have the risk factor, right? So could that knowing influence your choices? And I think that's the reason that people might want to have those genetic tests done, is to influence your choices. And remember, so I'm going to take away one point, is your brain is an energy hog, and how you maintain the flow of nutrients to the brain, that vascular system. If you are hypertensive, I know medications can really reduce the risk. If you're developing type 2 diabetes, the first organ to be affected by type 2 diabetes is going to be your brain, because your brain needs that glucose and it needs to utilize that glucose. So those are my two, and I'm just so thrilled. And as always, it's been fun to connect with all of you.
Thank you guys so much for your expertise. Dr. Caldwell, Dr. Mosconi, do you have any final words? We have about 1 minute left till we have to join Maria and Lauren. So any final words would be great.
I would just say, stay socially connected, reach out to those friends, and stay cognitively active. Don't withdraw. Give yourself a challenge, learn new things.
Yeah, I would say it's really important to think of our brains more like a muscle. There are really things that we can do to make our brains stronger. We can feed our brains properly, we can exercise them properly, we can take care of them properly, and their brains will perform so much better for us, really, at any age. It is never too late to start. It takes discipline, but the benefits are for life.
Absolutely. And shout out to Sonia. She said she's 93 years of age, and community and her family have been a big help. That is beautiful.
Oh, great.
Yeah, I will see you all in the other room with Maria and Lauren. Again, Dr. Brinton, Caldwell.
Thank you, Liz.
Thank you, ladies, for your expertise and your work in this field. It is beyond appreciated. Thank you all for being in this chat with us, and we'll see you over in the other room.